Hello, everybody. This is Gary. Today is September 19th, 2022. It is 12:49 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today I'm doing better than I was yesterday. The weather's kind of crappy today. It's raining outside, but that's to be expected. We're getting into late September and the fall. Um, Today my paranoia is not as bad as it was yesterday. Um, I did get some good sleep. I slept through the night, so I didn't have any insomnia last night. I'm seeing my psychiatrist this Friday at 2 p.m. We're going to talk about my increased paranoia, possibly raising my Klonopin in dosage from 1 milligram a day to 1.5 milligrams a day. And he may or may not add some medication for my paranoia. Lately, I've been thinking people are following me, spying on me, plotting against me, trying to hurt me. I'm in control of my behavior. I'm not violent or suicidal. Um, just doing the best I can to take it day by day and stick to my daily schedule. I'm going to go out for a walk later to exercise my right knee that I had surgery on May 13th. They removed a torn meniscus in my knee that was torn when I fell on the ice and twisted my knee. It tore the meniscus, and most of the meniscus was removed and trimmed back. So I'm just trying to get used to my knee walking around in a normal fashion with as little pain as possible. Um, I'm still taking Cymbalta for physical pain, Neurontin for physical pain. I'm still taking Flexeril for back pain and muscle pain. I'm still taking Tylenol and Motrin for pain in my joints and my knee. And all my other medications are pretty much the same as they've been. But there may be some changes when I talk to my psychiatrist on Friday. I'm seeing my peer support specialist next week, I believe on the 29th, and I'm seeing my therapist sometime in early October. So I'm just taking it day by day, one step at a time. If I feel like I'm in an emotional or mental crisis, there is a crisis center that I can go to that's not a psychiatric emergency room. It's just a place to go to talk to somebody and hang out and get evaluated without necessarily being locked into a mental institution or emergency medical ward. It's a come and go as you please kind of place, and it's just somewhere to go when you're feeling like you're in an emotional or mental crisis due to mental illness, whether that's anxiety or psychosis or depression or confusion or whatever it might be, mania, bipolar disorder, schizoaffective disorder, schizophrenia, hallucinations. My auditory hallucinations today are pretty much at a bare minimum. They're not really bothering me. My anxiety levels are kind of high. I've been through worse. My depression's not that severe. I've had worse depression than I do today. But the paranoia is still pretty much there. And it's possible the paranoia is increased because of cutting back on my Zyprexa. I had difficulty urinating. I had a catheter put in so I could pass urine. And the catheter's been taken out. But we suspected that maybe the Zyprexa at 20 milligrams a day was causing urinary retention. So we cut the Zyprexa dosage in half daily back to 10 milligrams a night. So my increased paranoia may have something to do with that decrease in Zyprexa. My dosage of Seroquel hasn't changed, and I don't want to increase the Seroquel. I'm already on quite a bit of Seroquel. I'm on 600 milligrams of Seroquel at night, and that's actually quite a bit of Seroquel. I've actually been on higher dosages, as high as 1,000 milligrams, and that's actually above the average safety level of 800 milligrams. But just trying to stick to my daily schedule, do things best that I can under the circumstances. I'm still in the process of recertifying for my lease for my apartment. My landlord is waiting for banking information to be sent by fax to the rental office here in my apartment building. And once they get that paperwork, we can renew my lease. My lease actually isn't up until November 30th or November 31st, whatever number of days are in November. Um, that'll mark my 2 years in this apartment, and I'm recertifying for a third year. Um, my rent is subsidized, so I'm only paying $400 a month in rent, and power, electricity, and heat are included in the rent. So that's not too bad. I'm grateful for having housing. I know a lot of mentally ill people are homeless. But I try to do my best to make sure that I take my medications, that I keep all my appointments, I keep my apartment clean, I pay my bills on time, and just try to stay as organized as possible. Like, comment, share, subscribe.